Joe is that we never could find where his primary lesion was. Sometimes malignant melanoma will pop up in a place at the back of the eye, maybe in a sinus, maybe at the back of the tongue. Some places are extremely difficult to find, and if we can't find it, that even lowers his prognosis even further.
At this point, I felt, I don't know, I was kind of numb, like this can't be for real.
Being told that I have malignant cells, essentially being told that you have cancer, very, very scary, and not really knowing what's next. Now I'm set up for surgery.
The fear must have been overwhelming to realize that everything that you had and all the good things that you wanted to give back to society and give back to our country is now just going to be whisked away from you.
Joe's surgery was a fairly simple procedure. To remove the affected lesion, doctors made a small incision along his neck and took out the lymph node. Still, the ordeal was wearisome.
When he did come out of the surgery, though, he was very pale and pasty looking. It was just, it was a weird sight to see. And I knew that he really was a sick young man.
After leaving the hospital, I was asked to follow up with Dr. Sims in a couple weeks from then, which I did. And during that process, I thought it was essentially a closed case. It was a done deal, so I could go back to kind of getting back on track.
For a while, it seemed like things might return to normal. Dr. Sims had Joe come back in for a routine CAT scan after a few weeks to check on his condition. The results were not favorable.
I go in, I get the CAT scan done, and about a week after the CAT scan, I then get another phone call from Dr. Sims' office stating that I need to come back into the office. And after the first time with this, I'm already thinking, great, here we go again, another problem.
Doctors decided that results from his CAT scan indicated that Joe was at risk for the further spread of his cancer. It was determined that more tissue and lymph nodes needed to be removed. This was a much more serious surgery.
We went back and did what's called a bilateral modified radical neck dissection. So we cut his neck from ear to ear and dissected the lymph nodes in the anterior portion, the front part of his neck, on both sides to determine if any other lymph nodes had cancer in it.
Again, the surgery went really well, and pretty much just like last time is, I'm going to follow up with you the next week in the office and see how you're doing and see how you're healing up, and I don't think we have anything to worry about.
But as it turned out, Joe had plenty to worry about. The surgery had not worked out as planned, and the malignant cells had spread rapidly to other glands. He was referred to an oncologist who put him on the experimental vaccine interferon alpha-2b. The protocol was rough on Joe.
I've never felt more physically sick in my life than being on interferon. It causes you muscle pain, joint pain, nausea, vomiting, you name it. I had it.
5 times a week for 8 long months, Joe endured the horrible pain of the interferon treatments and the constant sickness it brought on. Doctors continued to monitor Joe's progress. It seemed that, finally, they had slowed the advance of the disease. But then, a previously undetected mass appeared in a late CAT scan. More cancer cells had spread to Joe's muscles. It was the worst possible news.
At this point, I'm starting to worry about dying. I was in a fight for my life.
We cried together. I remember him saying, "Mom, I'm going to die." And I go, "Like hell you are. You're not going to die on my time." And I said, "If you think you want to die, then we'll go home. But if not, we're going to see Dr. Sims, and we're going to get this taken care of."
The third surgery involved what's called a radical neck dissection, which would involve removing not only the tumor, but the large muscle on the left side of his neck, as well as the internal jugular vein, all of the lymph nodes in that area, and also what's called the spinal accessory nerve, which is your 11th cranial nerve, which allows you to move your arm and your shoulder up above your head. We were forced to take the muscle, we were forced to take the internal jugular vein, but the spinal accessory nerve we were able to salvage and leave so that he did not lose the function of his left arm.
I remember upon waking up, the very first thing I did was pick my left arm up. And I had full range of motion. I could move it all the way up, and it was the best thing. You know, again, if I hadn't been through enough at this point, the medical oncologist then tells me, Joe, I'm going to be honest with you. You've done 3 surgeries. Your tumor has been so aggressive. I put you on an experimental vaccine or a vaccine for 8.5 months. That didn't work. What I'm recommending to you right now is that you start high-dose chemotherapy and simultaneous radiation. And then he tells me at the rate your cancer has spread, even doing this, you probably have a month to live, if that.
We had a lot of heartfelt conversations. I knew it was serious, but you can't be crying. You know, you have to be strong.
After everything that I had been through and then being told this, and I had a month to live, how do you deal with it?
Joe Brown had been through 3 operations to remove the cancer, and none had worked. He tried the experimental drugs doctors had prescribed, and the disease continued to spread throughout his body. Now they wanted Joe to endure radiation and chemotherapy, despite a prognosis that gave him just 1 month to live.
I've never really been like a foo-foo type person in terms of, you know, I feel this way for this and, you know, get those gut feelings. But I will say I had a gut feeling that chemotherapy was not what I was supposed to do. And with the prognosis, why do it?
There was no other option for Joe at this point. We'd already ruled out chemo and radiation, so there was no option.
But Joe and his family had no intention of giving up. He simply wasn't willing to poison himself anymore. He began to look outside conventional avenues for treatment.
Joe made a lot of phone calls to a lot of different people.
I was talking to anybody that I could to try to come up with some kind of solution or suggestion. Anything that was out there, I was going to consider.
And things just gradually fell in place. I mean, it just came naturally.